The Mammography Quality Standards Act updates remind us that every mammogram report must contain one overall final assessment of findings. Hello, it's Rick, and I'd like to invite you to join me in this mini moment about the final assessment of the findings category identified in Section 900.12, Paragraph C, Subparagraph 1, Subparagraph 4, Item G, Post-Procedure Mammogram for Marker Placement. According to MQSA regulation, when selected, this assessment must appear in the test results report as post-procedure mammogram for marker placement. It is defined as reserved for a post-procedure mammogram used to confirm the deployment and position of a breast tissue marker. It should not be lost in all of this conversation that the American College of Radiology also has a report organization called the Breast Imaging Reporting and Data System. However, at the publishing date of this mini moment, there is no BI-RADS categorization equivalent for the FDA's MQSA, Overall Imaging Assessment of Post-Procedure Mammogram for Marker Placement. Should an interpreting physician elect to incorporate BI-RADS categories into their interpretation of results, the FDA's Mammography Quality Standards Act requires all breast imaging practices to comply with the guidance that states an overall final assessment of findings classified in one of the following categories. The assessment statement is only the word or phrase within the quotation marks is required. This refers to incorporating a single overall final imaging assessment for the mammogram using one of the categories provided in MQSA's lexicon and the specific wording provided in the regulations when reporting the assessment selected. The approach to interpreting screening or diagnostic mammograms versus post-procedure mammograms for marker placement differs due to their distinct objectives. Post-procedure mammograms have as their primary objective to confirm the accurate deployment and position of the breast tissue marker following a biopsy or surgical procedure. Such accurate marker placement is crucial for guiding future treatments and ensuring proper monitoring of the targeted area. And while detecting new lesions remains important, the primary focus is on the marker and changes related to the recent procedure. Meanwhile, the report results prioritize confirming the procedure's technical success and providing a clear record for future reference in the post-procedure mammogram, contrasted with informing the patient and referring physician about any potential abnormalities and the next steps for recommended follow-up in mammograms performed as screening or diagnostic procedures. The post-procedure mammogram for marker placement significantly impacts various aspects of tissue sampling for breast cancer. Imaging practices must meet high standards of quality and operational efficiency to provide accurate and clear communication for referring clinicians and healthcare providers to plan, treat, and manage patient care. And most importantly, it requires understanding, compliance, and emotional support for each patient. The FDA provided multiple comments and responses regarding the post-procedure mammogram for marker placement assessment category. Several comments addressed the proposed final assessment category, stating it was unnecessary, asserting it was bundled into the interventional procedure, and questioning the need for documentation of a biopsy clip or marker. The FDA affirmed the necessity of the assessment category, referencing its approval as Alternative Standard No. 12 issued in 2003. The FDA clarified that when a post-procedure mammogram is part of the interventional procedure, it does not need a separate assessment. However, if it is logged or charged separately, it requires a separate assessment and report. Some comments recommended that post-procedure mammograms for marker placement should not be regulated under the MQSA. The FDA disagreed, emphasizing that post-procedure mammograms typically include the entire breast and are often logged, reported, and charged as independent examinations. Therefore, they should continue to meet MQSA quality standards. The final rule includes the post-procedure mammogram for marker placement assessment category as appropriate if a post-procedure mammogram is logged or charged separately. It must meet MQSA quality standards, including providing a report to the referring healthcare provider and a lay summary to the patient. The lay summary should mention the marker placement without suggesting any abnormal or suspicious results. Finally, comments recommended excluding mammograms used for localization from the medical outcomes audit. The FDA agreed and stated the required calculations in the updated MQSA final rule should not include mammograms used for localization. Only mammograms with assessments of suspicious or highly suggestive of malignancy are counted as positive. Thus, those mammograms with the post-procedure mammogram for marker placement are to be excluded from audit calculations. We hope this mini moment has enhanced your understanding of the vital role that the post-procedure mammogram for marker placement assessment plays in MQSA's overall final assessments. This assessment is indispensable for practices performing imaging-guided tissue biopsies to detect breast cancer. Embracing its importance can significantly enhance the ability of healthcare professionals to guide future treatments and ensure proper monitoring for patients undergoing breast biopsy at your practice. If you like this, please give it a like. Also, make sure to subscribe for more bite-sized information about other mini moments. Do you have an opinion or idea about something you want to hear about? Please leave us a comment. To get references to the information used here, check out the link to our Knowledge Hub below. Until next time, continue striving to enhance patient outcomes by delivering compassionate and precise breast imaging care.